Every year, thousands of children are born with a neurotube defect known as spina bifida. This affects the spinal cord as well as the backbone, resulting in long life challenges for the child or for any person suffering from it. According to the World Health Organization, 1 in every 1,000 global births have spina bifida, and this is a very big challenge because it may seem like a small number, but truly, when you look at an individual suffering from this, it has very big impacts on their life. And in Uganda, 1,400 children are born with neurotube defects, and those include spina bifida. The biggest challenge really is late diagnosis as well as not knowing what to do once the diagnosis has been made. So what is spina bifida and what can be done about it? NTV Medical Matters today dives into this. You are welcome. A very good morning to you. Today we speak to Merab Asimwe, who is awaiting graduation at Makerere University with a Bachelor in Social Work. She's living with spina bifida, but regardless of this condition, it has not held her down, and would like to share her story so that you too can be encouraged, or someone you know. So let's dive right into this interview. So Merab, first question, and by the way, thank you so much for speaking to us. So the first question, when was the first time you understood that what you have is spina bifida, and what was your reaction when it was explained to you?
My first time understanding that I have spina bifida, I had gone to Mbara. It is an organization, a partner organization for SHAW. It also supports persons living with disabilities and those living with spina bifida and hydrocephalus. So I had gone there. I was called for a training. It is always a training that is for people living with spina bifida and hydrocephalus. It is called Independence Week. I had gone there, and then the doctor was explaining for us what causes spina bifida, how it affects the child, and how it can be managed. That is the time I got to understand that I have spina bifida. As I was growing up, my parents always said the person who operated me from Morago Hospital affected me, affected my nervous system, so the lower parts of my body were affected because the person was doing the learning from me, so they affected me in such way. But when I got to get the information from ours, I learned that I have the condition, and I shouldn't be blaming that doctor every time, like my parents say. Yeah, so me to get in touch with ours, when I was a child, I used to get a lot of abdominal pain that were caused by my blood that had issues that was affected by spina bifida. So my father was referred to that hospital to see if they can assist me. So after giving him the medicine and giving him the information how I can manage the situation that I was in that time, they told him to bring me back for that training, because it is from that time they identified that I'm living with a condition that they are managing. So they called me for training. That is when I got to know that I have spina bifida.
All right, so take us through your day-to-day. What is your day like? Would you say it's a normal day that maybe I and several other people would do, or is there something that differs in your particular day?
How my day goes in terms of the condition of spina bifida, let me say if a normal person has to wake up at 6, I have to wake up at 5, because I have to do, it is called bowel management. Since I can't do the usual way of pushing stool, I do what they call bowel management, washing out of the stool, and have to do it every morning. So I always wake up early at 5. I boil my water, mix it, and put it in my bowel apparatus and wash out. Then I do, it is called self-catheterization. Catheterization, I use a catheter to remove my urine. So I move it, then to make my bladder relax, there is a medicine I use, it is called oxybutynin. I use it, I pass it through my catheter, and That medicine, it always affects me in the morning. I be dizzy, I be seeing blurry things, I can't concentrate, so I put it as early as possible so that I can get that time of resting before I start the usual day with others. Yeah, that is how my day goes. And then maybe during that day, I've done my bowel in the morning, in the day. I just have to use my catheter like any other person goes to the washroom to do the short call. Me, I use a catheter to remove my urine every time I feel my bladder is full. Yeah.
What are some of the main health challenges that you face as you go through this journey, but also how do you get to manage them?
I can say it's a medicine because when I use oxybutynin, the one I told you that is supposed to relax my bladder, among the effects it gives me, I told you about feeling dizzy, seeing blurry things, sometimes getting confused and I can't concentrate sometimes. So during the day, my mouth is always dry, or if I overtalk, my mouth becomes dry. So if I'm to talk so much or I'm in a place that is so dry in a sunny season, I have to be taking liquid or fluids. That's why I have to take water because I'm talking too much. So I have to take water because my mouth is dry if I don't take water. That is one effect of the medicine I use called oxybutynin. Whenever I'm in one place, let me say I've sat for so long, I will have the back pain because the back is also affected. It is like curved, so I don't have to sit in one place for a very long time. And also when I oversit, I develop pressure sores. Can I say my bum? Yeah, I develop pressure sores. So in my movements, whenever I travel for a very long distance, whether by bus or taxi, I get pressure sores under my feet. The doctor told me my blood doesn't flow well when I'm sitting, so I develop pressure sores under my feet. Then when I'm sitting in one place, like I'm sitting here on the chair, I get pressure sores on the bum when I oversit. So I have to be sitting, then I go and relax. Yeah.
Mirab, are there specific things that you've learned so far that help you make your day easier and generally your life that you didn't know before when you first got to know about this condition?
So I learned how to not compare myself with others, and then I learned how to accept what life brings, because some of the things I can't do anything, whether I cry, whether I feel emotional and sad. Yes, sometimes it comes because I'm human. But I learned how to accept and not to compare myself with others, what I cannot do.
This one may be a little bit sensitive, but what are some of the most difficult moments in this entire journey that you can remember?
Yeah, the most difficult moments of my journey, it's when I was still young and people used not to associate with me, because they were always informed, I don't know from who, from where, about their parents, that my condition is contagious. They can also get it. That was my childhood. And I got to start studying primary. You know these things, you've not finished food and people want to eat other people's food, but me, when I leave it, no one would eat it. And whenever I'm in a new environment, people are looking at me so differently. They are not concentrating on others, but it's me they are looking at. And then other hurting moments, I've gone to church or at school, and since I was incontinent, I would become wet. After becoming wet, no one could sit near me. And maybe we were in church, my mother had to go and look for a mop where I was sitting. She has to mop. These things used to get stuck in my mind and they could hurt me very much. And then in my school, I had to use Pampers. To use Pampers, at first my parents couldn't afford them so much. So they had to buy nappies. I was to depend on nappies, and I used to look at myself in those age 5, 6. My my age mates, they just come to school, they're only putting on a nick. I have to be in a nappy. I have to be in those panties that have, I call it a chivera inside. Those moments used to hurt me so much. So those moments I used to yearn, I wish, because I knew I can't control it, so I used to yearn, I wish my parents can afford buying Pampers.
World as well as Uganda, who is living with the spina bifida, but regardless she has fought on. And to help us understand this condition even better and its causes, prevention as well as the cure required, we are joined by Dr. Agatha Namutosi Wakama, an associate consultant pediatrician, Jinja Regional Referral Hospital. Welcome and thank you so much for joining us.
Thank you very much. Good morning, our viewers.
So let's begin with the understanding. For someone hearing this for the first time among our viewers, what is spina bifida?
Spina bifida is a term it's a Latin term that comes from two words. The spine is our backbone, and bifida is something split. So it's a split, a defect, which is where your spinal cord is split. So this is where when a baby is developing, usually in the first 8 weeks, the spinal cord and the brain are being formed from a structure called a neural tube. So if there is a defect in that, along that tube, there could be any problem with the brain, or even along the spinal cord, where we call spina bifida, when it has not closed well. So spina bifida is a defect on the spine of the babies, and it occurs very early during formation of the baby. It's going to appear by the 8th week. The spinal cord is already formed. So if a defect is to occur, it has already occurred by the 8th week of pregnancy. Yes.
All right, so it happens during the formation of the baby. So what are some of the things you would say it's attributed to, especially during the mother's preconception or lifestyle? Does it form because of something she's done wrong, or is it something unavoidable?
So there are some known causes. The most common is folic acid deficiency. It's a micronutrient that is found in foods, and it's not in adequate levels to help with the formation of that neural tube. So deficiency of folic acid, or what we call folate, is highly associated with spina bifida. And actually countries that have had supplementation or fortification of foods with folic acid have greatly reduced that incidence of having spina bifida. The other common cause is some drugs, which you call teratogens. Exposure during that critical time of pregnancy could interfere with the formation of this neural tube. And the commonest here is a drug that is commonly used for treating epilepsy called valproic acid. It is highly teratogenic to pregnant women and could cause spina bifida. The other cause is there are some genetic predispositions. Someone is genetically predisposed to having spina bifida, where we find spina bifida running in a family. Either the mother herself had spina bifida and gives birth to a baby with spina bifida, or a previous pregnancy that was affected by spina bifida. The risk also increases with the subsequent one. There are genetic problems that could, first of all, affect the way that folic acid is going to be used. Like you lack an enzyme that helps your body to use that folic acid in the right way. So the baby will be born as though they are born in deficiency. Yes, so this happens even if you've been supplemented with the folic acid. The other one is when the spina bifida occurs with other genetic problems. There are syndromes which we call Edwards syndrome, or the trisomy 18, or Patau syndrome. These ones, the child has spina bifida with other associated factors, a heart defect with their feet, and other things like kidneys. Yes.
So the main cause here is a lack or an underutilization of folic acid.
Yes.
Are there any other causes that can be avoided?
So folic acid is the commonest cause and causes the largest risk, the deficiency of folic acid. And it's the easiest to actually prevent, because all you need is the supplementation of folic acid for women in childbearing age. You may not have so much control over genetic predisposition. Maybe you're born with a genetic problem in your family. But again, also avoiding potential drugs that could cause this defect. Like I've talked about the valproic acid. So a girl who is being treated with valproic acid for epilepsy should ideally, the drug should be changed at the time when they get into childbearing age. Yes.
Is there like a severity when it comes to spina bifida, or are there types, or is it one general thing?
So yes, they are. Spina bifida is really a broad term of a group of defects where there is a defect in the spinal cord, in the vertebrae, actually the bones, what we call the backbone. So at the point, the backbone could be split, and the severity is going to occur according to what is damaged, because within our vertebral column runs what we call the spinal cord. Now the spinal cord, take it like a tree with roots. So the tree is like the spinal cord, and the roots are the nerves that go to help our body function, to either help us move, control our bladder, control our defecation. So according to the level, first of all, the impairment is going to be different, but also according to what is coming out of that defect. So we have the mildest forms called spina bifida occulta. With this one, we have the defect within the bone, but the spinal cord is intact. So that one could be very difficult to detect, because there might be very subtle signs, like as small as a dimple on the back, and the baby could have no impairment in their movement. They are functioning well. The other one is a meningocele. So there is a defect, and what comes out of it is structures that cover the spinal cord called the meninges, with the fluid, that water on the back. It's the same water also that is in the brain. So that one is more severe. Like it's still mild, because in this case, the nerve roots are still spared. This is water coming out of that sac, and maybe the coverings. Now we move on to the more severe parts, like the types like what we call a myelomeningocele. Now myelo comes from spinal cord. Meningocele is the meninges, and cele the water. So we have the sac that is coming out of that defect, and within that sac we have the spinal cord and the nerve roots coming out. So these ones, the child is also going to manifest differently. The signs are going to be different. And we even have the type, the most severe, called myeloschisis, where it is open. It's really open. There is no skin covering it. You can see everything right from the time the baby is born. Yes. So the impairment, the disability this child is going to have is going to depend on whether they have a occulta, or they have a meningocele or myelomeningocele, or myeloschisis. And also, the impairment can depend on the level, because the spinal cord is running all the way from the back of our head down up to what we call the coccyx, the bone, the hard bone where you sit on the butt. So in there is the spinal cord. Like I told you, that tree, look at the tree with roots, but it ends at some level. So if we get it high up where we call the cervical spina bifida, it could affect your breathing muscles, because again, these nerves are coming like in a radial form, coming to help our body to move, to contract, to control things. So if it's high up, you could have issues with breathing. You could have a deformity, what they call kyphosis. You find these children, when they sit, the back curves outwards, and they have a sharp protrusion at the back. And if it goes down to where we call maybe the lumbosacral, it's actually the commonest, the lower back. Now, nerves coming out of there are probably supplying the bladder and also the legs. So you find that these children have, maybe they're not able to walk normally. We've seen Asimwe having crutches to assist with movement, because there is reduced innervation, like supply within the legs. And the same area, you're going to have nerves coming to supply our bladder. If you want to urinate normally, you can hold the urine up to when it's appropriate. But these children do not have that sensation that, oh, I want to urinate. No. When the bladder fills up, the urine will pour out. And also, because they don't feel like, I want to maybe go and defecate, so they could hold the stool or even the stool can come out inappropriately at inappropriate times because of loss of that sensation. Yes.
Well, you said that the condition happens during the formation of the baby. Yes. So if it happens at that time, how do you diagnose it? And if it's found out at that time, is it reversible?
So unfortunately, when the defect happens, it's not reversible. When the neurotube has formed, by 8 weeks, you cannot reverse the defect that has happened. But there are tests that you can do to detect it early. There is what we call a test in blood, where you test for a substance called alpha-fetoprotein. It's non-specific, but if you find it higher than normal levels, then it could point to a possible neurotube defect, not specific for spina bifida. Then that is done about 16 to 18 weeks, and it should be followed with an ultrasound scan, what we call the anatomic ultrasound scan, which can be done very well at 20 weeks. And this scan looking at the spinal cord, how the vertebrae, the bones of the spine are moving. And if there is a problem, a defect, it can be detected at that age. In other advanced countries, there's what they call amniocentesis, where they can do a tap of the fluid where the baby is growing in the sac, and they test for that alpha-fetoprotein to detect spina bifida. So when you do the scan, what can you do? In more advanced countries, they are doing what we call in utero surgery. They do the surgery when the baby is still in the uterus, in the womb, growing. Yes, this does not reverse what the function the baby has lost, but it preserves. Okay. Because being born with a defect and exposure to the environment, there could be added risks. Okay. However, in our setting, we do surgery as soon as the baby is born. Yes.
So what kind of treatment and surgical intervention is needed in this case, and how soon after the child's birth should it be done?
So it is really surgery to close the exposed spine, and as soon as possible is what we recommend to do. Within the first 48 hours, it's going to help reduce a lot of risks and exposures to this baby. So a mother who is carrying a baby with spina bifida, diagnosed during pregnancy, should plan to deliver from the hospital that can perform the surgery immediately, or at least be connected to the nearest hospital within the first 48 hours of delivery. Yeah.
Thank you so much for that clarity. So we shall be going in for a commercial break, but welcome back from the break, and thanks so much for staying with us here on NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. I am Viola Sasira, and in studio with me is Dr. Agatha. We are discussing spina bifida, and before we went off, we were talking about surgery, which is why, Doctor, wanted to ask you, so the child must get surgery, you said, and it's very important. So why is it very urgent, and at what time should it be done?
Okay, thank you very much, Viola. Like I said, it should be done ideally within the first 48 hours of life to prevent complications. So these complications I'm talking about are, this baby is born with a sac on their back, or even really exposed spinal cord. So they stand a very high risk of infections. If that sac opened up, then you expose it to the outside, and then germs could enter and then cause an infection right there at that point. But it can also go upwards to the brain and cause what we call meningitis. Yes. So the urgency is to prevent infections coming in, but also further damage, because the exposed nerves, yes, you've lost some function, but if you have more damage, then the disability is going to be worse by damaging more nerves. So we encourage early closure of that defect to prevent infection, to prevent further damage. And this infection could actually go to the brain and cause what we call post-infectious hydrocephalus. So spina bifida itself is highly associated with hydrocephalus. First, because of the defect itself, that the child could be born with the spina bifida and hydrocephalus at the same time, because of how they are growing. The brain and spinal cord are very interrelated. There is a condition called Arnold-Chiari-2 malformation, where you have spina bifida, and then somehow some structures at the back of the brain are pulled downwards. So they close off where that water is supposed to flow, and you end up with hydrocephalus. But also that infection that can go to the brain can actually cause blockage of the water of the brain where it's supposed to pass. So that is the biggest risk that we fear, and we encourage that the child should be operated as soon as possible.
Post-surgery, what is some of the other care or therapy that a child like this might need?
Okay, so spina bifida management is really interdisciplinary. It is not just to the neurosurgeon who does the surgery, but the aftercare is long-term, because this defect is not going to, the disability they suffer is permanent, as I can say, but there is things that they can do to mitigate the disability that they have and to improve function. So there is a very big role of physiotherapists and occupational therapists to help these children move their limbs. We've seen children come from thinking that they will not be able to move to being able to move, at least with crutches. And also because of that problem that we talked about, the nerve holding the urine and the poop. So because of that, the impairment they have on the nerve that controls the urine, so their bladders are in a sort of very rigid. Yes, they don't relax well to allow the bladder to feel well so that they can pass urine. So we see, like Asimwe talked about, having a drug called oxybutynin, and to help that bladder to relax. Take an example of a balloon. You're supposed to blow, it's supposed to accommodate some amount of water before you feel like you want to urinate it out. But this bladder is very stiff, that any small amount of urine wants to come out. But also because of that stiff nature, it has high pressure, that some of the urine goes backwards into the kidney and could cause kidney failure. But they have very high risk of getting urine retention. They empty, but they don't empty it completely. So that urine that remains back causes them to have very frequent urinary tract infections, UTIs. So to prevent that, there is a team of nurses that help with the bladder care. So they train these children to do what we call clean intermittent catheterization. They teach them to pass a catheter into the urethra, into the bladder, to draw out that urine, like the natural way. So they time themselves like a normal person could, like Asimwe talked about, she has to time when the bladder could be full. You go get a private place and pass a catheter and then let out the urine. And then the same is happening with the poop as well, the bowel management. There's a kit where they go and wash out the bladder. So they don't get the sensation that my bladder is full, I need to go to the toilet, but they have to time. Then also, there is a lot of psychosocial issues. These children don't understand the question, the condition. The child will be wondering why she can't run around like other children. They tend to have anger issues. They tend to be stigmatized at school. And then also, our schools may not be very supportive, because those who are able to ambulate, they're having crutches. They may not be able to move at the same pace as other children. Others are using wheelchairs. So some schools don't have that facility to assist the child with wheelchairs. But even giving them the privacy to go and do the bowel movement, the bowel management, and to remove their urine. So most of the school toilets do not have that kind of clean environment. So it is really multidisciplinary. It's coming from the surgeon who has done the surgery. We are looking at physiotherapists. We are looking at orthopedic surgeons correcting some of the disabilities that they have. They have high rates of club feet. So you've seen the baby in the picture with the cast on the feet, treating the club feet. We have psychologists, we have mental health experts, we have pediatricians dealing with these UTIs, we have urologists. We have a very big team, even the teachers really and the parents.
I'm sure this is why such shows are relevant. I mean, if some of them are watching, they must understand the kind of plight this person is going through. Mirab actually talks about going through school and feeling like she wanted to give up, but she had a bit of support, and so she was able to push through. So thank you so much for that detail. And we're going to be having phone calls, dear viewers, so you can be able to ask questions. I see someone asking a question on Facebook. What is this? You know, as wild as it sounds, what is this? Like, what he's watching is like, is this real? So that's someone called Jones K.A. We also have Sandy Leston, who says it is so good, I'm in the show. But then Jones K.A. says otherwise it's a good health topic, but the government should make things easy for us and give us, you know, like free treatment, free access and all that. We shall be talking about where this where this support can be found, in what hospitals and how available is it. But that's something Jones should wait for. Otherwise, our phone lines are open and you can get through to the doctor.
Okay.
So how can we increase awareness amongst the mothers, especially? I'm particularly interested in folic acid. In what foods do we find folic acid? Where can we get the supplements? Yeah, and what other foods do the mothers need, or other information they need to know to save their babies?
Okay, thank you. Speaking about awareness, I'll just mention that one of the biggest hospitals that is managing spina bifida is Kiwa Children's Hospital of Uganda in Mbale, and October is the spina bifida awareness month. They've just run a marathon for helping contribute towards the surgery of these children. The marathon was last Saturday on 18, but people are still welcome to go and support that big cause. And also, people could visit these hospitals and see these children, that we have this problem with us. It's highly prevalent in our setting, with up to 1,400 children every year being born with spina bifida in our country. So it's very common, but then maybe people who are not in the hospital setting may not see it. So about government support, it's upon us doctors and health workers to keep encouraging all our women in the reproductive age to take folic acid. Folic acid is entirely free in the hospital facilities. From the level of health center too, you can go and get a strip of folic acid for free for a whole month. Unfortunately, people go there when it's late. Someone starts antenatal care when they're 3 months pregnant, when the defect has already occurred. But even you, Viola, you can walk to the hospital, you can go to Mulago, you can go to Chisenyi Health Center and ask for folic acid, and anyone should give it to you for free. It's one of the most available drugs in the hospital. And if you decide to buy, a strip is about 1,000 shillings. That's a 10-tablet strip. So it's very available, very affordable, and it's important that we take it. Now, for women who have had spina bifida themselves, they need even more. So the recommended is 400 micrograms of folic acid every day as a supplement for women in childbearing age. But if you have an increased risk, either you have spina bifida yourself or your first baby had spina bifida, then their requirement is 10 times more. Yes. So most of the supplements, when you look at these multivitamins for women, well woman, they actually have that content of folic acid, but not everyone is able to afford it. Our foods that we find folic acid, we have the green leafy vegetables. You look at spinach, those green leafy vegetables, dodos, they have a great amount of folic acid, but it's not adequate enough. Yes. The beans, the liver, meat, they do have folic acid, but not to the required. It's good enough for you as an individual, but when you're going to carry on a pregnancy, then you need extra. Yes. So I urge all of you to go to a government facility and get folic acid supplement.
What more information should the caretaker of a child with spina bifida watching us right now, what more information should they know? But also for such a child, what more should be included in their daily care that can assist them live a relatively better life? Okay.
So for children living with spina bifida, we encourage frequent reviews at the hospital. We're looking out for UTIs. We test their urine for UTIs. We test their moving ability. So the level of physiotherapy that these children are doing, how is it yielding? And they also have very high risk of getting sores, the ulcers, the wounds on their buttocks. Because remember, according to the level of their disability, they may not have sensation downwards. Yes. So they can get burnt and not realize that have been burnt. They can get a cut on their legs and they will not realize. So we urge the parents to really be keen and help out these children, to allow them not to sit in one place for long, not to stand in one place for long, to really avoid these issues of the pressure sores, but also we encourage to do scans of the kidneys to just look out for possible kidney failure because of the recurrent urinary tract infections. So it's recommended to do at least twice a year, every 6 months, to look at the kidneys of these children. Yeah.
Okay. So we shall be playing another part of Merab's story where she actually has a question for you.
Okay.
All right, so Merab, at this stage, is there any medical assistance you're receiving, and what does that look like?
Having spina bifida, I have to go through a very long-term rehabilitation. I have to go for my reviews after 6 months. I get my reviews from Katale Machesha home after every 6 months. And when I'm in the West, I get my review from hours in Bara. Yeah, that is the medication I'm on. And then I have to check my weight according to the medicine I have to use, and then to change the crutches. And maybe if I want to change the wheelchair, the doctor has to first measure my size. Yeah.
All right, so now we request you to speak to our viewers and maybe give them a word or two of encouragement, especially for the ones that are living with this condition or know someone that has the same.
The message I have for people living with this condition, like I told you, the things I learned: acceptance and not comparing themselves to others. Living with spina bifida, there is nothing that can be changed. You can't be operated. It's only use of catheterization and bowel. So they have to accept what it is and concentrate on what they can, and what they cannot, they leave it, because there is no one that is doing everything in this world. Everyone has what they can't do. Yeah, that is all I can say. And maybe to the public, spina bifida, it's cheap to prevent, but it's expensive to care, to manage it. The prevention, it is only use of folic acid. Folic acid, and we get it from our usual food, the vegetables, the fruits. And for the foods, you don't have to overcook them or over-fry them to get that nutrient called folic acid. Yeah, and then another information I have for the public is people with spina bifida and hydrocephalus, if they are given the reasonable accommodation, accessibility, they can also be productive. Yeah, they can be independent and productive like any other person. If they are given the accessibility, those who use wheelchairs, they can access their offices, they can access the classes, they are in the community, they are not stigmatized. Yeah, that is the information I have for them.
Thanks. And finally, it's time for you to ask our doctor a question that you have that might be pressing.
The question I have for the doctor is there any research that is being done about spina bifida? Maybe how it can be managed, apart from using maybe catheterization and bowel. Is there any research? Because currently we know it is the only management that we are having, but is there anything or any research that is being developed for it to be managed without use of that? Yeah.
That is Merab Asimwe, living with spina bifida, and she posed a question to you, Dr. Agatha, that is there any development so far in making life easy for someone living with this condition? Especially, she's concerned about using a catheter as well as clearing out the bowel where they can do it naturally.
That's a tough one because of everything with the bladder is coming from the control of the nerve.
Yeah.
Like these are like electric wires that are helping you to hold something, and that is lost. So to create an artificial nerve is quite difficult. But all I know is there is, first of all, the oxybutynin has been shown to be great, and it's already being used, like she talked about, where they can inject it direct into the bladder to make it more accommodative of more urine, the volume. But then there are also bladder surgeries, what they call bladder augmentation surgery, where they do a surgery to increase the volume of the bladder so that it can hold more urine. So I'm not yet sure if that's being done in Uganda, but I think our surgeons, our urologists could have an area that they could tap into and see how they can improve the quality of life of these children. Yes.
I actually had a concern for Merab. While we had a conversation, Merab had to constantly drink water, which also now increases the amount of time she has got to catheterize, which I think is very tough for her.
Yes.
So is there an alternative to the medicine that she's taking that literally dries out her body?
Wow. You know, we need water for our bodies. And she talked about that drug oxybutynin. It has several side effects, one of it being causing a dry mouth and that dizziness. So it's actually encouraged to keep hydrating so that they overcome that dry mouth, but they constantly want to drink. But then also, the more you let out urine, the more you're clearing your bladder of any bacteria that could be stagnant there and cause you UTIs.
Okay.
Yes.
All right, that's good.
So it's actually healthy for her to drink more water.
So to wind up our conversation, from your standpoint, what vision do you see for Uganda in terms of reducing the burden of this condition, as well as maybe handling it better and addressing questions like what Merab has posed and I believe several viewers might have out there?
I think my message is we need to take this condition serious. Like Merab said, it's very easy to prevent and yet very costly. I cannot know how much amount of the GDP that goes to managing these children with spina bifida. So we've seen from countries like the US, they've reduced it by 28% just by supplementing women with folic acid. And this doesn't just mean the drugs, the tablets, the folic acid pills that you need to take, but even food manufacturing companies. You look at people who are making cereals actually fortified. You look at the Kellogg's, the Weetabix, they have some level of folic acid. But we can also encourage our local food producers to add in, to fortify their foods, to increase more folic acid. That if you're getting the daily food that you're eating, the population is feeding on rice, is feeding on posho, that posho has extra folic acid within it. So that alone from research has shown to decrease tremendously the risk of spinal defects. Yeah.
Okay, spina bifida is a part of neurotube defects,
Yes.
You know, a family of them. What others are out there and how best can they be reduced as well?
Okay. So spina bifida is one of them, and this is really for the spine, but we also have the brain, and these are really very severe. We have conditions which like anencephaly, where there is no brain. Anencephaly means a lack of. So the child is born with a head, and then somehow from here, there is no brain upwards. Then we have some types of hydrocephalus, like what we call hydranencephaly, where there is water just without the brain, or very small amount of brain within that skull. And then we have, you see how the spinal cord we can have a sac out of it. You can also have the brain coming out of it, what we call encephalocele. So the brain is coming within a sac, and unfortunately most surgeries, they just cut off that. So the child is going to have impairment because of missing some parts of the brain. But even then, they could appear normal, but then there are some sacs of water within the brain. All those are neurotube defects. Yeah.
How best can we prevent them?
Take folic acid.
Oh,
every day.
All a result
folic
of
acid. That's the one, the best preventive measure that is known, and really reduces it to a very big percentage. But again, don't just wait to get pregnant and take folic acid. Start at least 3 months before, so that you have enough stores of folic acid within your body. Because remember, I said the neurotube is formed by the 8th week of pregnancy. It has already been formed. So you don't wait. Take folic acid for as long as you could become pregnant at any point. All women of childbearing age should take folic acid.
Okay.
Yes.
All right, so before we can continue with your final remarks and any information you might have for our viewers, I will just pass a small announcement here for our dear viewers as you think through your final remarks. So we are talking about the Spina Bifida Day, which is going to occur on the 25th of October 2025, and it will be celebrated in different districts organized by SHAHU, Association of Spina Bifida and Hydrocephalus of Uganda. So ensure to watch on several TV stations, listening from different radios, as well as if you can make it, go to the district centers where it will be observed. And so as we close today's episode, let's talk about your final message to our viewers.
Okay, my final message is let us really look out for these children with spina bifida. It's a complex condition. We need support of a multidisciplinary team we've talked about, from the parents accepting this condition, then the children, and we look out for their psychological well-being. Yes, they face a lot of stigma from their schools, and sometimes they're labeled with names, omlema, you know. But disability is not inability. These children have normal function according to their brain. They can attain school performance just like any other children. They can compete favorably. They can work, they can be productive members of the society. So let us encourage them, let us not stigmatize them, but also maybe for the schools, I'll still talk about this, let us make it the environment conducive for these children. Let us make the classrooms accessible for them. You know, most of our high schools have storage buildings without a part for a wheelchair. And then the school toilets, we need to encourage an area, a clean area for these children to be able to remove their urine and the bowel management. So we make it possible for them to attend school. But then also to have more treatment centers. Maybe this is to the government. So currently there is Chiwa Children's Hospital of Uganda, there is Mbarara Regional Referral Hospital, there is Mulago, and then other private facilities that are doing these surgeries where you find neurosurgeons, maybe like IHK, TMR Hospital, but those are really few according to the numbers of the children that we have. But even then, the post-surgical care. So we need more centers that can have these children taken on from close to their homes. You see, Merab can only get care in Katalemwa, or in Mbarara. What if she was in Soroti? What if she was, you know? So if we could have more centers, more trained nurses to manage children with spina bifida so that care can be continued from their nearest health facilities close to their homes.
Okay, something else. I just remembered. We need to could you please talk to our Luganda-speaking audience about the importance of folic acid as well as the foods they should be focused more in order to prevent this?
Okay. Abawuliriza baffe basaba okumira akalungo ke bayita folic acid kasangibwa mu madwaliro nga kabwerere mu madwaliro gaffe aga gavumenti niwoba osobodde osobola okagula mu pharmacy kali affordable ka strip kabeera ka 1,000 era tusaba abakyala abali mu biseera ebyokuzaala okutandikira ku myaka nga 15 buli omu abeere ng'amira akalungo ka folic acid. Emmere gye tusanga kana akalungo nga greens, naye greens zino zinofumbibwa mu ngeri nti akalungo tokatta okufumba nnyo, si kirungi okufumba nnyo greens zaffe. Mu greens, mu ekibumba, ne beans, ebijanjalo nabyo bibeeramu ne fruits nga grapefruits nga pineapples, apples nazo zibeeramu akakalungo. Naye ekisinga nti weetaaga ekisingako okumira obwo obukerenda obwa folic.
All right, thank you so much, Dr. Agatha. And with that final remark from her, we have come to the end of today's episode of the NTV Medical Matters. But just remember that every story shared brings us all closer to better health, and that is our goal here. So we are supported by Bill and Melinda Gates Foundation. I am Viola Xasia, and being Spina Bifida Awareness Month, which will count the 25th of October, that's why we had this discussion, and I hope that it was good for you. Otherwise, from the team and I, we wish you a fruitful week.